Good afternoon, everybody. Welcome to the CPC Winter Seminar Series. Really glad to have you all here. I am Jeff Hancock. I'm the director of the Cyber Policy Center, and I'm thrilled to have Jo Robinson here. She is joining us from the University of Melbourne, where she is part of the Center for Youth Mental Health. I feel like there's a real Australian connection these days. Stanford and the Social Media Lab and Matt Jenskow have been identified as the lead academic partner for evaluating Australia's social media ban that takes place this December. And so it's really exciting to have Jo here and for her to share her expertise. I think, like many of us here at Stanford, she thinks really carefully about interventions and takes a real evidence-based approach. And in addition to that, and why she's so relevant for the group here, is she then thinks a lot about how that should inform policy and make good policy. And she's done a lot of work at a high level, including with Meta's policy group around harm reduction with children. So please join me in welcoming Jo to the CPC. Thank you so much.
Thanks so much, Jeff, and thank you everybody for having me here. So as Jeff said, my name's Jo Robinson, and I lead the Youth Suicide Prevention Research Group at Orygen, which is the Centre for Youth Mental Health at the University of Melbourne, and it's a real pleasure to be here, so thank you for having me. I'm here enjoying a short sabbatical at Stanford, so I've been immersed in kind of the world of Stanford with colleagues at Centre for Youth Mental Health, but also kind of dabbling around the tech industry and meeting with some industry colleagues and partners over this last couple of weeks. So this all feels really timely. Just before I get into it, I would like to acknowledge, I'm using the wrong thing, the traditional owners of the lands that we do all of our work on. So in Melbourne, Australia, we're on the unceded lands of the Wurundjeri people of the Kulin Nation, and I would like to pay my respects to their elders past, present, and emerging. Alrighty, so I'll get straight into it. So as I said, I lead a research group all around the prevention of suicide and self-harm in young people. And unfortunately, in Australia, suicide is the leading cause of death in young people. And I don't think we're alone there. I think it's the leading cause of death in a lot of other English-speaking Western countries, possibly also the US. We're also seeing increases in suicide in some sectors of the population, particularly younger females, which is an unusual demographic pattern. Suicidal ideation and self-harm are also common and appear to be increasing, and actually so is mental ill health. So what we're seeing is this picture of increasing rates of depression, anxiety in young people, increasing rates of self-harm, increasing rates of suicidal ideation. And what we're now seeing are those increases playing out, unfortunately, in the suicide statistics. And suicidal ideation, self-harm, mental ill health, they're all associated with a whole range of negative outcomes. So they're all associated with other things like poor vocational or educational outcomes, poor housing outcomes, and those sorts of things. But they're also associated with increased risk of suicide. Now, the reasons for self-harm and suicide are complex, and I'll come back to that in a second. But I'm sure everybody here is aware, and as Jeff said, particularly in Australia, we're very aware at the moment that there's a lot of concern about the role that social media might be playing in this increase that we're seeing in terms of mental ill health, suicide, self-harm in young people. So when we first started this work, many years ago now, the sorts of things, it was around 10 years ago, and the sorts of things we were concerned about were things like exposure to distressing or graphic information, which was then linked to an increase in suicidal thoughts and behaviours amongst some young people. And we were kind of, I suppose, when we started this work, at a bit of a pivotal point with social media. You know, the dominant narrative really in suicide prevention was that social media was bad and young people shouldn't be using social media to communicate about suicide or self-harm because of this potential for harm, because that they could be exposed to certain types of information that could lead to kind of imitative kinds of behaviour. So the reason we were concerned about things like graphic depictions of suicide and self-harm is partly because it can be obviously distressing and traumatic to be exposed to that content, but also because it can potentially have imitative impacts for other young people who might be vulnerable. And a lot of that evidence came from the mainstream media, actually, not from the area of social media, because it was all a little bit new then. But there are clearly some fundamental differences between traditional media and social media. And young people, and I'm sure we're all perfectly aware, have a unique relationship with their online worlds. And it's quite different probably to the relationship that somebody of my generation would have with my online world. So what we did is what we always do at Origin, and we talked and listened to what young people had to say about this. And we're sort of saying to them, the suicide prevention sector are saying we need to get kids off social media. I feel like we've now come full circle in Australia. We need to stop having these conversations online. But really, young people told us that, first of all, that simply telling them not to have these conversations on social media wasn't really going to work. Young people don't necessarily always do the things that adults ask them to do. But also they told us that they use social media for particular sets of reasons and purposes. And some of those can have inherent benefits as well as the harms that we're concerned about. So all of this kind of, I suppose, in terms of the context around the potential for harm is what, and a whole series of other harms as well, has led Australia to the place that we're in currently, where we're about to institute this ban for under 16s on social media, and we can talk a bit more about that later maybe. But there are some benefits. So young people, I keep doing this on my laptop instead of on the clicker. So as I said, young people told us that they use social media for particular sets of reasons. And remember, this was kind of many years ago when we started this work. So they use social media to seek help, particularly in, potentially in a suicidal, self-harming crisis. They use it to share their own lived experience or distress. They can use it to support a friend, and interestingly, that was found to be therapeutic in and of itself, that actual piece around being able to help somebody else. They use social media to grieve or memorialise for people who died by suicide, including celebrities or public figures, but also including people in their offline worlds, and to share news of a public or celebrity suicide. And there were some key or inherent benefits to those types of social media use. And you can see some of those here. So there was the opportunity to obtain accessible help. You could access social media and help through social media 24 hours a day, 7 days a week from the privacy of your own bedroom. You could help others. You could stay connected to friends. You could communicate with others with shared problems or shared experiences. And this was particularly important for people in marginalised groups or marginalised parts of the community. You could foster a sense of belonging, or it fostered a sense of belonging and connectedness. And we know actually a lack of belonging and a lack of sense of connection are inherent risk factors for suicide. So by being able to use social media to foster connectedness and to foster a sense of belonging actually can work to mitigate suicide risk. So it's not as cut and dry, I think, as some of those dominant narratives would like to have us believe. Social media can also be used to disseminate information quickly and in an acceptable way. And I'll talk a little bit about an example that we've been working on later around how we've used social media to disseminate suicide prevention information in an acceptable way to young people. It can also potentially be used to deliver evidence-based tools or interventions for people who are having a mental health or a suicidal crisis. So lots of potential benefits. Alrighty, so I'm going to take a change tack a little bit here and talk a little bit about the complexity around suicide. So we've kind of got the background about that initial relationship with suicide and social media. And we are at a pivotal point again, I suppose, in our relationship with social media. It's come a long way since we started this work 10 years ago. But we've also at a pivotal point where it comes to mental ill health and suicide in young people. So as I said at the beginning, we've got this problem. A lot of people kind of wonder or ask me if this is a pandemic-related problem where we're seeing these kind of increases, steep increases in suicide, self-harm, mental ill health in young people. I would say the data suggests that actually these trends have been operating well before the pandemic started, but the pandemic certainly exacerbated things. But what we have started doing is thinking about suicide in this much as I suppose, applying this kind of multifaceted social deterministic lens to understanding the complexity that drives somebody to a suicidal crisis. For a long time, and I've been, I work at the Centre for Youth Mental Health. We're very much located in a medical school, in a psychiatric paradigm. And for a long time, we were really looking at suicide as a mental health problem and the solutions to suicide being a mental health set of solutions. More recently, there's been an understanding or a kind of an acceptance that actually it's much broader than that. The causes and the reasons for suicide are much broader, and so are the solutions. So myself and some colleagues worked a little while ago to develop this sort of framework, which sits under our suicide prevention strategy that just got launched recently in Australia. And as you can see from the diagram, what we've done is mapped out some of those social or structural determinants that might contribute to suicide risk, but also can be used for the purpose of suicide prevention, and then looked at the relationship between those social or structural determinants and the socio-demographic risk factors, so age and gender and culture, things like that, and then some of those individual clinical or contextual risk factors over here, and really kind of understanding that relationship can be very bi-directional. What the column over here on the left shows are some of those kind of social determinants or those broad social policies that we can look at and might be levers for suicide prevention activities. So what we've got up here are things like economic policies, public policies around kind of, consumption of alcohol, labour market or social policies around housing, and, all sorts of different policies that can be used as levers, or we should be thinking about when we're starting to think about suicide prevention. I guess the one that I want to draw your attention to today, and in relation to this work, is this piece around regulatory or legislative frameworks and how they might apply to things like online regulatory frameworks. That's something that we haven't really been thinking about up until now in suicide prevention. So we're quite used to thinking about healthcare access and coverage. We're quite used to thinking about housing or education and the roles that those sorts of sectors might have on suicide prevention. We haven't really done a good job. You might have done a better job in this country of thinking about firearm ownership, but we haven't really done a good job anywhere in the world, to the best of my knowledge, thinking about what opportunities or levers we've got at policy level when it comes to regulatory frameworks and online frameworks and suicide prevention. So, to the best of my knowledge, there is very little mention of social media and how that could be used preventatively in any suicide prevention policies around the world. And there's very little, if any, mention of suicide prevention or mental health in any online frameworks or regulations. So I think there's a gap, and I'll come back to this later, but there's a piece here around suicide prevention in all policies. The other thing to draw people's attention to, I suppose, is that there's been a real recognition of some of this complexity recently, certainly from the clinical and academic sectors. So I was involved in a couple of Lancet commissions, a Lancet commission on self-harm and a Lancet psychiatry one on youth mental health. And both of those pieces of work acknowledge the complexity that is driving the youth mental health crisis. And both of them acknowledge the complexity that's driving suicide and self-harm. Both acknowledge the role of social media. It's likely to be a factor in all of this, but it's not the only factor. And if we really do focus purely on that, what we're doing is ignoring all of those other social and structural determinants that we could potentially be using as important levers. So social media is really unlikely to tell the full story. So again, I'm just going to take a moment to introduce this framework. So this is a framework that people may be familiar with. I don't know how many people here come from a kind of health or public health kind of background, but it's very commonly used in public health, where we think about kind of a layering, I suppose, of approaches to things like mental health promotion, suicide prevention. So what you've got at the bottom of our pyramid are universal or general population approaches to preventing suicide or reducing mental ill health. And here we think about, and this is at the bottom of the pyramid because it targets the broadest range of the population. They're general population initiatives that target anybody regardless of risk. And here we think about things like reducing access to means of suicide, so things like firearms. We might think about media guidelines generally around safe reporting of suicide. And we might think about public health or universal media campaigns that are rolled out to promote help seeking, increase awareness and education, those sorts of things. As we work our way up the pyramid, we start to look at selective interventions for groups who might be at elevated risk of things like suicide. So these might be people who are experiencing mental ill health, or people who have been bereaved by suicide or exposed to the suicide of somebody else who we know are at elevated risk of suicide themselves. And then there's a suite of interventions, things like screening or case detection and gatekeeper training interventions that we tend to use for that population. And then at the very pointy end of our pyramid, and it's up at the pointy end because these are much more targeted interventions, targeting people who are already at risk of suicide or self-harm, but it does reach the smallest number of people. And that's where we think about things like referral to clinical services, single session therapeutic interventions, safety planning, pharmacological treatment, and online interventions. So that just gives us a bit of a public health framework for thinking about suicide prevention. And what I'm going to do now is talk a little bit about how we've applied this